Thank you very much for having me this afternoon. My name is Cindy Slater and my session is going to be looking at clinician training for the Queensland public health sector using a portal known as the Clinical Knowledge Network, otherwise known as CKN. So in my role, I actually work for EBSCO. I'm a Senior Customer Engagement Manager. So I essentially provide training on the EBSCO resources in the medical and corporate markets, and I provide training across Australia and New Zealand. I've been with EBSCO since 2014, and in a former life I was actually a clinician. I was a podiatrist working in Victoria and also over here in the NHS for a number of years. But I've retired my scalpel now and I just do the training on the medical resources. So in this session we'll go through an insight into how I deliver this training across Queensland to make sure that staff know how to access the resources and know how to get the most out of these resources. So before we start, some of you may have been to Queensland before. I know it's very far away, but some of you may have been there before. But Queensland is actually the second largest state in Australia. It's nearly 5 times the size of Japan and 2.5 times the size of Texas. And it's 7 times the size of Great Britain. So there's a lot of flying. And its area covers over 1,700,000 square kilometres, or just under 667,000 square metres. So a very large area, very large country. Most of the population of Queensland actually live outside of the greater metropolitan region, which is a bit uncommon to other states and territories in Australia, where most people tend to be in the capital cities. And Queensland is home to more than 4 million people. Now, the Clinical Knowledge Network, or CKN, it's a research portal, and within this portal are a range of resources, and these resources are available to everyone working in Queensland Health. EBSCO is responsible for managing this particular portal, so that's where my role comes in as CKN trainer, and also for managing relationships with over 45 medical publishers. EBSCO provides the training resources, and it also provides a 24 hours a day, 7 days a week help desk. So within CKN, or the Clinical Knowledge Network, there are 211 public health services, and these are grouped into 16 different hospital and health services, or HHSs. And CKN also includes the Queensland Ambulance Service, or QAS. There are 35 large public metropolitan hospitals, 87 regional public hospitals, and there are approximately 80,000 clinicians in Queensland who access CKN daily. So I've mentioned that the portal contains a number of different resources. There's a selection of some of the resources in here. And if I look at them by grouping, so we've got a range of different research databases. So EBSCO and non-EBSCO resources within there, a range of drug information resources, so therapeutic guidelines, Australian Medicines Handbook, all these things are going to be relevant to the clinicians. There are a number of point-of-care tools or decision support tools. And there are also subscriptions to a number of e-journals and e-books. So CKN has direct subscriptions to JAMA, to BMJ, the Lancet and the New England Journal of Medicine, to name a few. Now, these 80,000 clinicians mostly access CKN when they are on site, so via IP access. But there are approximately 12,000 active registered OpenAthens accounts. And they use these OpenAthens accounts to access CKN when they're off-site, so maybe from home, or maybe they want to access CKN from their tablet or their smartphone device. The CKN itself site is mobile friendly. So this is an example of the registration form that they fill out to register for the off-site access account. And on the CKN website itself, there are places where they can go to register for the CKN account and also to manage their account. Down the bottom of the page, there's a big button there. That's where they can go to register and to renew or update their details. Now, other ways that we promote the off-site access account, there is an FAQ section available on the homepage, the CKN homepage, and this goes through some commonly asked questions. And hopefully, if someone has got a question, they can find their answer there and they can move along with their searching. There's also a short video on Vimeo for those who like to watch things and then be able to replicate that. And there are also flyers as well. Now you can imagine this state, this huge state with clinicians spread across the state. There are some challenges in terms of people being able to access resources, get the most out of the resources. So we've got this large state, the population is spread. There's also some diverse information needs. So the resource portal itself covers these different products that cover the range of different specialty areas, things that are going to be relevant to the clinicians. So ranging from paediatrics all the way to gerontology, from inpatients to outpatients, looking at acute or chronic conditions, for direct clinical to maybe more administrative or policy writing. The resources cover all of these different areas. So we need to provide training options to cover these variety of specialty areas. The resources in the portal, as I've mentioned, are a mix of EBSCO and non-EBSCO resources. And I take this responsibility of being CKN trainer very seriously. Even though I work for EBSCO, I want to ensure that there's non-biased promotion of resources. In my view, I don't mind which resource somebody uses, as long as they know the options that are available to them via the CKN portal. And there's also these diverse access options. So a number of people will access CKN when they're on site, but you've also got people who are accessing it via community settings. So for example, we've got oral health specialists who will work in caravans and travel around to different schools. So they need to be able to access CKN when they're not on site. You've also got the mobile users, for example, the paramedics in Queensland Ambulance Service. Each paramedic in QAS is issued with an iPad, and that is what they use to keep up to date with all of the information. So of course they need to have that off-site access account, that OpenAthens account, in order to access CKN from wherever they are. Now, there are many benefits to having this OpenAthens account or off-site access account. We've got the seamless authentication, so they can move through the different resources within the portal without having to authenticate each time. It allows the users to access CKN away from a Queensland Health computer. So you've got those clinicians who work off-site. We've also got a number of clinicians who are completing postgraduate studies. Just last night, I received an email from a nurse that I'd done some training for. She's doing some postgraduate studies, and in her email, she happened to mention the benefit she gets from having that OpenAthens account because she can do her research, find her journal articles for her assignment when she's home at night. And then we've got the benefit for people who are on call. I remember doing a training session for pharmacists, and one of the pharmacists mentioned that the benefit that she gets from having the off-site access account is that when she's on call and she receives a phone call, she can log on to CKN, she can find out the information that she needs to either relay that back to her colleagues, or she can decide that maybe based on what she's been presented with and what she's then found, she might have to then go in and present at the hospital. So these are some of the benefits. The form itself is very easy to fill out. Don't seem to have too many problems with people filling out the form, and the process to register for the OpenAthens account is very quick. They can also manage the account from the CKN site. And for me, one of the benefits is being able to deliver a number of different training sessions. So as well as delivering on-site training, I also deliver off-site training via webinars. Now, I'm actually not based in Queensland myself, I'm based in Melbourne. And for those of you who know Australia, Melbourne is about a 2-hour flight away from Brisbane, even longer for towns that are further north of Brisbane. So by me having an OpenAthens account, this allows me to provide a lot of training via webinar. And I've done training across different times, different days of the week as well, to try and capture the different times that clinicians may be available. I've done training sessions as early as 7:30 or 7 a.m. or 7:30. I've done morning, afternoon, early evening, and even late evening or overnight sessions, all via my OpenAthens account to try and reach people working all different times of the day. Also from a cost standpoint as well, being able to deliver more sessions via webinar is more cost effective, as well as still being able to go up to Queensland from time to deliver on-site training. For on-site training as well, I do try to tend to focus on going into protected time. I find for clinicians, because they are very busy, if I try to target my training into protected time, handover time, meeting time, in-service time, there's more of a chance that people are going to be able to attend the on-site sessions. Now, before we go across and have a look at the CKN site, I'll leave you with this quote from a paramedic that I did training for. And this is him describing the benefit he finds having this OpenAthens account. So, since the inclusion of having the external access is found an integral part of his ongoing professional development, he works as a solo officer in a very rural and remote area, so it allows him to keep up to date with the latest best practice and also information on complex or rarely seen patient conditions. So we'll have a look at the CKN portal. So this is what it looks like. So there's the discovery search there, so they can search across the CKN resources. They can select individual resources down the left-hand side or from the middle part of the screen here. We've got the help desk information on the right-hand side. Further down the page, we've got the webinars. I tend to keep my webinars on the shorter side of things. I find that clinicians are very busy, offered a 60-minute training session, they often can't attend those, so I try to keep them around the 30-minute mark. 45 minutes is probably my longest training session. And down the bottom here is where they can register for their off-site access account. So from here, they can go in and they can select the particular resource that they're interested in and get authenticated into that particular resource. So you can see I'm authenticated, part of CKN, and here's my name up here in the top right-hand side. If I go back to the search portal, I can do a search from here. So its aim is to search across the CKN resources. And then on the results page in the right-hand column, you'll see that we've got links to other CKN resources. And from here, so they want to move to MIMS from here, they can click on that and they can get taken into MIMS without having to enter their credentials again. So I'm taken into MIMS and I'm taken directly into that search topic that I was searching for, insulin glargine. So nice seamless navigation through the portal. Back on the homepage, there is a champions program. So there's one of me and there's 80,000 clinicians who access CKN. So a couple of years ago, I started up a Train the Trainer program, essentially to have people on the ground who are willing to champion CKN, to promote it to their colleagues, maybe to provide some recommendation for resources, things that they found useful. And I do all of these training sessions via webinar, via my OpenAthens account. So that's just a snapshot of CKN training. Are there any questions before we finish up today? I'll just go back to my slides. Sorry. Thanks. Which one do you need? That last one. Thank you. Okay. So are there any questions before we finish up today?
So how do users get credentials? So they register
That's right. So they can click on that button that says register, and from there they're taken to a page where they can fill out the registration form from there. So they just have to provide enough information to prove that they are a Queensland Health.
Is a human then verifying this request, and do they send them an email, or does it go automatically?
It's automatic, yeah. So once they fill out the form and they nominate a username for themselves, they fill out the rest of the form, including their contact details, their location and their role. There's the terms and conditions they read through, and if they agree to that, check a box. They click on register, and then from there they receive an email where they can then set their password from there.
Okay, and those credentials are valid for a specific period of time?
12 months.
12 months,
yes.
And then they have to renew it?
Yes, they can just renew that, yeah. So they just get an email and they can just renew it from there, or they can do it from the CCAN site itself. Any other questions? Okay, well, thank you very much for your time today. If you have got any questions coming out of the session, or if you'd like to find out a bit more information or keep in touch, please don't hesitate to contact me on the email address. Thanks. Thank you very much.